at this point, there's not a whole lot of answers as to, okay, what do we do about it? Obviously, we know some answers because we work with it so intimately day to day, but parents don't know these things. And sometimes these delays are caught so late that, you really miss a huge window to make a big impact super early on. So the idea behind our app is that we are developing this developmental tracker that's going to track your child's progression. You're going to be able to monitor their milestones, primitive reflexes, and all these things that are super important for development to check and see if you have any delays in them. And then if a delay pops up, then there's going to be some answers for you.
Welcome to the Longevity Formula with Dr. Brandon Crawford. Let's explore the new era of wellness.
Hey everyone, welcome back to the podcast. Today we have one of my absolute favorite physical therapists. This is Dr. Trevor Montgomery. He is currently working with us in Austin at the NeuroSolution Center of Austin. And today we're going to really get into some very interesting topics. I think you're going to really enjoy this conversation. So Trevor, thank you so much for joining us today.
Thank you for having me. I appreciate it.
So the first thing to get down to is you're another small town Texas boy.
Oh, absolutely.
So we got to talk with Dr. Cordell Miller, right? Mm-hmm. And so he was from Whitney, Texas.
Right.
I'm from Clifton, Texas, 20 minutes down the road. You too are from Whitney, Texas.
Yes, sir. Absolutely.
So tell me about your take on growing up in small town Texas.
Man, small town Texas is a great place to kind of grow up and, really kind of establish yourself as a person. A lot of just good hometown values. Family is very important. Faith is a very important thing there. So, you get exposed to all that sort of stuff. And it's just a nice, chill environment to kind of grow up in. So yeah, I prefer it over the busy city area. Although I love it here in Austin, it can be a little chaotic sometimes. So
that's one word to use. Yeah, right. Absolutely. Yeah, it's always interesting, in small towns, it's like everyone knows everything about you. Mm-hmm. I know that's how it was in Clifton. Like you couldn't throw a rock across the street without 5 people hearing about it within 10 seconds. It was pretty interesting. But so you're a physical therapist. Yes, and one thing I want you to kind of walk us through is the educational background, because you're actually a doctorate, right? So you're a doctor of physical therapy.
Yes, sir.
Can you walk us through what that looks like, please?
So from the very beginning, you've got to have a bachelor's degree in some sort of degree. It doesn't really matter too much. I got mine in kinesiology at Texas A&M Commerce. And then PT school itself is a 3-year program with didactic and clinical work. So you go through all kinds of things: neuroscience, gross anatomy, cardiopulmonary education. And, the PT profession is, a doctorate level profession. So you're seeing patients right after surgeries, right after major accidents. So it requires a lot of education. And also you're seeing people right off the street coming in, just seeing you for the first time. That's kind of the purpose of being a doctorate program, is that you can see people right off the street. So you have to be able to differential diagnose and also refer them to the correct providers.
Absolutely.
So it's a high level field. Yeah. Absolutely.
What was your favorite class going to school in PT school?
So I'll split it between 2 because I liked them both pretty equally, but orthopedic and neuroscience. Yeah, absolutely.
I know we were just talking about gross anatomy. So that's where you actually dissect the human body, right? And so we got that. Physical therapy gets that. So how was that for you guys? Was that fun? Was that gross? What was it like?
Oh, man. It's pretty jarring when you first walk in there. So how we had it done was we had 2 separate lab groups. One day, one group would dissect, and then you would come in and look at what they dissected and kind of check it out. So I started on the back end of it. I came in after they had already kind of been dissecting it. But yeah, it's very jarring when you first walk in, because it's like the realization like, oh man, this is a body right here. Yeah. This was a person at one point. And, beyond that though, you kind of get used to that, and then it just becomes getting down to work, and it really becomes super interesting to kind of really dive into what a body actually looks like on the inside. Pictures can only tell you so much. Yeah. You really get a great idea of what all the different layers of muscle, fascia, tissue, nerves, and where it all kind of intertwines and connects. It's not so neat and cut and dry as pictures make it look.
And it's all gray.
Oh yeah, no, absolutely. It's hard to identify those things.
It was interesting. I know we had a really robust gross anatomy program at Parker University. It was amazing. We did that for a full year.
Oh my goodness.
I mean, we got to dissect every square centimeter of
right.
It was amazing, but at the same time I'm actually really chemically sensitive. I know that sounds weird, but I would have nosebleeds that entire year because of the chemicals that they use to preserve the bodies and everything.
Right.
That was interesting, but invaluable. I mean, it was so I don't think invaluable is the right word. It was extremely valuable to be able to see like real human tissue and like how it interacts with, so you can actually see this stuff when you're working with someone. Mm-hmm. Very important. So prior to coming here, what exactly were you doing?
So I was working at an outpatient orthopedic clinic in Lewisville, Texas. So a little bit outpatient orthopedic, but also we did vestibular rehab there. So seeing patients post-surgery, low back pain patients that had experienced falls, all kinds of different vestibular issues, your BPPVs, your central disorders, all that kind of stuff. So yeah, I really got a kind of a full spectrum of wide experiences when I started there. Kind of established myself as a physical therapist, but was definitely looking for the next step and more education beyond that.
You think you went the next step by coming here?
Oh, absolutely. 100%. We're at the pinnacle, I would say.
Fantastic.
Yes, sir.
I would hope you would say that since I'm sitting right next to you.
Right.
No. So can you kind of contrast a little bit about what you're doing? And I love PT. Like I think you get an amazing education. I've worked with several physical therapists in my career. But can you kind of contrast like what we do here versus your traditional PT approach? So
PT is very exercise based at its core. There are some uses of like passive modalities and things, but they're not really talked about in the way that we talk about them here. We're really focused on the sensory systems here and really driving sensory input in order to improve motor outputs, which I kind of figured going through when I was like working with these patients. I'm like, man, this is important. I can remember a specific stroke patient that we had that was 6 months out of a stroke. And he, traditional PT says those impairments are set in. You're not going to make that many changes beyond that point. So he had the classic contracture right here. But I had been talking to Dr. Cordell Miller about what you guys do here. He didn't give me the full story, but he did tell me, hey, we use like vibration and stuff, and it really helps with muscle tone. So I just started taking a vibration tool and literally applying it to his triceps every single treatment. After about 4 weeks of that, I noticed he was all the way down here. He no longer had that just resting tone there, and he could like let that arm relax.
Nice.
Yeah, so absolutely. It kind of highlighted to me that there's more to this than what my education to this point had told me about. And of course, coming here, we use all kinds of different sensory modalities, and we really value that. And I think it is a real value in the rehab process for neurological patients, but also your general low back pain patients and really everybody. I mean, sensory is huge.
Absolutely. When I'm lecturing and everything, I always tell people sensory drives motor.
Right.
And it's really just based on how we develop. How a baby is designed to develop and how we're supposed to develop our brain from the bottom up. And, we have to make sure that those sensory systems are integrated.
Right.
And then that leads into our primitive reflexes, right? Did y'all get primitive reflex?
So we had a pediatric class and we talked about primitive reflexes, but what I remember from it was, okay, these primitive reflexes might be there. But there wasn't really too much talk about, okay, we can actually integrate these in a meaningful way. They're like, sometimes these things just continue to persist and it's just something that's there almost. Yeah, so that was my exposure to it. So I was exposed, which was really nice coming in here. It's like, okay, I remember this now. Now I can actually utilize that information to help people heal.
Yeah, it's interesting, because, it's not just the PT field, even pediatricians. Like I remember having a conversation with a pediatrician and, the conversation, I don't remember exactly how it went, but it was something along the lines of, hey, do you check primitive reflexes in kids over a year old? And he said, no.
Right.
And I said, well, why not? And he said, well, because they're not there. And I said, well, but what if they are?
Right.
And he was like, well, what do you mean? I'm like, well, what if they are still there? Right. And he's like, well, why would I check them? They're not supposed to be there. I'm like, but they could still be there. Right. It's this whole concept. It's like, whoa, like this is completely missed in so many different professions. pediatricians, neurologists, unfortunately, like I spent the weekend in California. I got to hang out with some pretty intelligent people. One of them was a neurologist. And this is this is a Harvard grad. Right. This is someone that was, very respectable. And same thing, she was like, well, why would I check primitive reflexes in a kid older than 1 or 2 years old? There's no reason. They're not there. And I'm like, but what if they are?
Yeah, no, absolutely. We see adults with them.
Exactly. And the interesting thing is that's a sensory motor roadmap,
Right. Absolutely.
I mean, it's beautiful because it's literally the brain screaming, hey, stimulate here and you're going to help me grow my networks and my neurons and my brain.
Right.
It's beautiful how we're all connected like that,
Absolutely.
Well, what about, so I love vestibular therapy, right? So is there a major difference in how we approach vestibular care in functional neurology versus physical therapy?
Absolutely, 100%. PT ends up getting pretty standardized as far as rehab structure and how they go about things. So it's pretty set that you just do your standard VOR up and down. But one big difference that I noticed here was we actually look at the canals and see which canal is most affected and then train those canals in order to more specifically treat the vestibular disorder. If those listening don't know what we're talking about, we have this structure on our inner ear, and it's these different canals in our vestibular system that tell us where our head is in space, but specifically in the anterior direction, horizontal direction, and posterior direction. And you can bias that out side to side as well.
Right.
And that's such an important piece. We talk about it as far as BPPV, which is, when these little otoconia or crystals get lodged in there and then you can reset them. But that's the only time that PTs ever really talk about canals as far as my understanding of it.
Right. That BPPV is benign paroxysmal positional vertigo, which you can do a Dix-Hallpike repositioning maneuver.
Right.
And reposition those otoconia. We have other methods that we can do as well that we've gone through here.
Sure.
It gets quite interesting. So we have a patient coming in right now. It is just top of mind. And she has a pretty severe spinal curve, right?
Right. Yeah.
And so last week, we evaluated her. The other thing I love about what we do here is it's a team approach. Right. And we saw this vestibular imbalance in her, right?
Absolutely.
I believe she had a more dominant or pronounced left vestibular response. So the vestibular system is kind of like a seesaw, So if the left side of the vestibular system is firing too high, the right side's firing too low. And there's so many different ramifications that can come from that.
Right.
One thing to point to, and in reference to this case, is the vestibulospinal pathway, right? So that vestibular system fires down to the spinal muscles. So this girl has this pretty major spinal curvature. And we started doing cold calorics, right?
Right, absolutely.
So what did we see from that?
So what cold calorics are supposed to do is balance out that vestibular side, right? So you put the cold water in one side, down regulates that side, up regulates the other side.
Yep.
And then you see, kind of this sequela of muscle tone balance that happens from that. So when you're doing the maneuver, you'll also see that the nystagmus that you were seeing at rest going to the left actually starts to switch. And then you see a big nystagmus the other way, letting you know that, okay, now we're starting to achieve balance here. And then what further lets you know is, we're measuring autonomics and seeing how that response balances out as well. Heart rate comes down, oxygen saturation goes up. Okay, good, we're on the right path. And then, we do some additional stuff, focusing on some canal work that then even further straightens out that curve. And it's amazing to see.
Yeah.
100%. Like, scoliosis gets talked about again in the PT world as this set thing.
Right.
And I've seen it change before my very eyes here. So it's, eye-opening.
It is. It's quite amazing. And, you have to be very certain about what you're looking at in front of you.
Right.
Because you could, put the cold water in the wrong ear and that person is not going to have a good time.
Absolutely.
So there's, you mentioned the nystagmus, which is that rapid eye movement. So you'll have a fast phase nystagmus towards the dominant vestibular side, right? So we had a left fast phase nystagmus in this patient, which is what you were referencing. And I've seen so many people come in, especially in the brain injury world. They'll come in with this huge spinal curve. They're bent over almost at like a 90-degree curve. We'll do this, and the spine literally right before it just straightens out.
Right.
And that's what we're seeing in this girl, is that we're seeing that spine straighten out. It's quite amazing to do that. So did y'all get any caloric background? I'm just curious. I don't know.
No, not at all, actually. Okay. This was my first exposure to it. literally. I mean, it may have been mentioned like one little sentence in a lecture at one point, but wasn't talked about as like a therapeutic tool to use.
Right. And that was the same for us in chiro school and in chiropractic. It was not until I got into functional neurology that we, really thoroughly got into it. And so it's not just PT. It's like the majority of professions. It's like, why teach them that? But, here we're using it pretty intimately. So
yeah, absolutely.
Okay. So I know that you really like to converse with patients. You do a great job of establishing rapport. So many people come through here and they end up loving you. You probably don't even hear this, but we do. We get a lot of, people telling us how amazing Trevor is. And I was just talking with someone last week and I completely forgot who it was, but they were saying, man, Trevor does a great job of pretending like he's playing with my kid, but he's actually doing therapy. Right. And so the kid is like having fun and they're involved and all this kind of stuff, but you're actually doing therapy with them. But you have this concept of like wanting to really understand that patient's story and their belief system and really, trying to meet them where they're at. Absolutely. So can you kind of walk us through a little bit of that?
Yeah, no, absolutely. Everything in therapy is very context dependent. You've got to apply treatments under the appropriate context, meaning I've got to be able to sit there and ask a person a question and actually hear what they're telling me and hear their story and hear where they think that their issues are coming from. Because I may have a whole bunch of ideas in my head about like, oh, okay, I think I know what's going on here and you're thinking this way, so I'm going to do this. But if I don't hear them where they're at and kind of approach them with like, okay, I understand this is what you're believing right now, and it's totally valid because that's your experience, right? So just that process of talking to people, understanding where they're at and focusing where they want to focus, but also taking them to the next step of what might actually be, a new barrier that they break through with treatment. Absolutely.
I love how you just explained that because so many times I'll be, and it's usually talking with a parent, right? Because, and I'm usually talking to the mom, just to kind of break it down. And I will literally say, what do you think is going on? Right. Because I want to hear what's going on in their head.
Right.
But I mean, you're talking about way beyond that. It makes me think of another patient. We were doing our V-cell procedure, which is a regenerative medicine procedure. And we do mind-body work with that. And of course, I'm faith-based. I'm a Christian. I've got, crosses in my office and everything.
Right.
And this was, I believe they were Muslim, I think the patient was.
Right.
And you could tell they were almost kind of like, I don't know, scared or, something like that. And Dr. Jerry and I, we were talking with them and said, okay, what kind of music do you want to play? And she said, well, I'd like to play this prayer. Right. And we were like, great, let's do it. And they were like, really? You'll let it? I'm like, yes, absolutely. Come on. Like, we're going to meet you where you're at. Like, let's go. And it was cool. Like we did this Muslim prayer and played their song and all this kind of stuff. I know it's a little different than what you were talking about, but
no, I think it applies perfectly. Yeah, that's super cool. Absolutely.
But you're right. I mean, you do really have to focus on the whole context of the situation. Right. And if you miss that, shame on you as a doctor, right? Because it can't just be a one-way street.
Absolutely.
So important. So how does that dovetail into a discussion of fear, right? Because that concept of fear is big, and I know it fits in here. So how does that kind of fit into patient care and like really how you help lead a patient through this?
Yeah, no, absolutely. So again, patients are going to come in with their own beliefs about what's causing their issue. And in turn, that can lead to a fearful response to what may be potential triggers for them. So I can remember just in my old job PT world, I had a patient that had this hip pain. And I would ask her, like, we were working on stuff and she would feel pretty good during our treatments. And I would say, okay, well, when is this pain flaring up for you? She's like, well, every time I go to the grocery store, I can only walk for this amount of time. And then I've got to sit down with my pain. I'm like, huh. I was like, does it happen any other time? She's like, I mean, it comes and goes, but it really ramps up when I'm going into the grocery store. And I wish I would have been a little bit more seasoned at this point because I would have had a little bit better ability to kind of walk her through that at the time. But it was something that was highlighted to me like, man, this is a very particular trigger for her is going into the store. And kind of unfortunately, but fortunately, I was heading here about that same time that I was getting into that with her. But yeah, no, absolutely. Fear is a huge component with that. Speaking more to it though, I dealt with a lot of balance patients as well. And that is where the fear, you can just see it on their face whenever you're trying to get them to do a new thing that's challenging for their balance. So whether it be just simply standing up, walking over a hurdle, standing on a foam pad, you can see those cerebellums kind of struggling a bit to turn on. And that kind of leads into, breaking through a barrier and getting them to do it. And then all of a sudden you see some confidence start to build. Mm-hmm. And once they break through that barrier, then it's like pretty, not immediately every time, but pretty immediately for a lot of people, they can steady themselves and they push through that fear. And that can apply to so many different cases. It doesn't have to be a balance case. It could be me doing passive range of motion on a patient's arm who just had shoulder surgery. Mm-hmm. And that's a big barrier to push through, is letting me like passively move their arm.
Yeah. No, that can be extremely fearful.
Right.
Are you kidding me?
Yeah.
Like
absolutely.
Someone with adhesive capsulitis and you're telling me you're about to move my arm up like this?
Right. Absolutely.
That can trigger all kinds of fear responses.
Sure.
Well, what about like your own self? Have you had to push through some mental barriers and get where you're at?
Yeah, no, absolutely. So for me, social anxiety is something that I've kind of dealt with my whole life. Just different scenarios. I've always been like a super quiet guy, but also a very sensitive, kind of emotional person.
I would not have thought that.
Really? Yeah. I hide it well. Yeah. Just very sensitive to how others around me are responding to things and all that sort of stuff. So that can put the brakes on my ability to jump into a social scenario. And there's just been many different phases of my life, like going into college, going into PT school and all that sort of stuff where, I really had to just kind of force myself into social scenarios because I knew that was going to be the path to the next level. I knew who I wanted to be. I knew the kind of clinician, the kind of person that I wanted to be was someone that could talk to somebody back and forth and approach people and be, appear confident and be confident. Mm-hmm. It's not just about appearing. It's about, really getting into that mindset where you push through that barrier and, just put yourself out there.
Absolutely.
Yeah.
Which
is huge.
You had this social anxiety, and like I said, I can't really tell, right? Mm-hmm. Like everyone here, you've done a very good job of overcoming this. So right. What would be some ways, or what are some ways that you've overcome this yourself? Like, what have you done for yourself to help you overcome that?
Right. So, just kind of almost educating myself on the topic of social anxiety and what it is, listening to, a lot of people that help other people push through that sort of stuff. So, your Tony Robbins types, just different people on the internet that, have really good advice mm-hmm. for pushing through that stuff. I'm kind of a person, I like to find out for myself how to do these things. So seeking out that information and then just putting it into practice. I mean, there's no way you can take in all the information you want about this stuff. You can, do as many affirmations as you want in the morning, but if you don't go into those scenarios and really put yourself out there and make it happen, it's not going to happen.
Right. That's a very Tony Robbins-esque approach, right? It's the concept of action. Mm-hmm. Absolutely. He talks all the time about how you push your body to train your mind, mm-hmm. right? And sure. That's essentially kind of what you're saying is you've got to do it, mm-hmm. produce action, do right. it. And we can talk about this from various perspectives. Mm-hmm. I was going to go in the direction of cold plunges, but right. I know that you're a huge cycler. So which direction you want to go here? Which topic you want to talk about first? Let's
go with cycling just because it's so personal to me. Yeah. So I've been a cyclist my whole life. Started out mountain biking with my dad from the very ripe age at 5 years old. And that's always been something that's just been a big part of my life. And if you've never done an extended bout of cardio, you don't really know what people are talking about when they talk about the runner's high or whatever. Mm-hmm. But doing those sort of things, there's a point where it sucks, right? It's hard. It's just no way around it. But you feel as you go through that, you kind of push through that physical barrier of okay, this is hard. I kind of don't want to do this right now. This is sucking in this first 5 minutes of doing it. But then all of a sudden you hit this certain flow state where the blood gets to your muscles, the endorphins start running through your body, and then all of a sudden you're kind of just in this flow. And, that is just speaks to the barrier that you push through physically and really gets you to a point where you just feel really good, honestly. And then, doing that sort of thing prior to going into a social scenario has always been really important for me. I know I've got to work out. I know I've got to do my cycling and all the things to kind of really push myself past that physical barrier. And then it kind of makes the rest of it easy because you feel good, first of all, but then I did all of this really hard stuff before this. I can do this social scenario. Right. I can sit here and talk to this person. Like, this is no big deal.
Right. So you did a great job. I would describe it as sensory drives motor. So we already talked about that. And motor drives cognition.
Right.
And that's exactly what you just described, because you're right. Once you get the body moving, it gets the mind moving. And then you can create with your mind. You can do all kinds of things.
Right.
It's amazing. So would you tell someone, and we both have to acknowledge that there are extreme cases of social anxiety that we would suggest, working with a psychiatrist or, someone like that. So we're not telling people, hey, just go out and do hard things, period. Right. We understand that there are scenarios where, we definitely want you working with qualified healthcare professionals, et cetera.
Absolutely.
But setting that aside, if someone is kind of struggling, whether it be social anxiety or just fear in general, do you think that approach of, hey, prepare yourself, prepare your body, go through the actions, rinse and repeat, is that something you would suggest?
Oh, absolutely. 100%. It doesn't have to be cycling. It doesn't have to be running. It can be going outside and just taking a walk.
Right.
I mean, that's, something that most people can do. Again, there's extreme cases where some individuals may not be in that place, but doing something physical that's extended, that, makes you kind of push through a barrier. For example, this morning, I was nervous about this podcast. Like, I was nervous about coming here and sitting down and talking. And I could feel it in my chest first thing in the morning. Immediately, I said, okay, I've got to get up. I've got to go for a walk. Like, I've got to prep my mind to do this. And 2 minutes into the walk, I felt the anxiety come down, and I was starting to think about, okay, this is what I'm going to talk about. This is how I'm going to say it.
Nice.
So yeah, no, absolutely. Yeah. It's something I would suggest.
Just for the audience, Trevor's walk is more like a light sprint. If you see Trevor walking, and I'm doing air quotations, through the office, it's like my jog. I mean, this guy is like flying through the office. So it's not a slow, leisurely walk that you were talking about.
No, absolutely not. It's quick.
Oh my gosh. Yeah, absolutely. Okay. So cold plunges, we brought this up.
Sure.
I think that, I'm a huge fan of cold plunges. Hated them in the beginning, like everyone. And honestly, look, before I get in a cold plunge now, I'm like, yep, this is going to suck. I don't really want to do this, but that's the whole point, is the pain pleasure response, right? And that's really what you just went through describing, is this concept of how pain and pleasure are connected. And we're talking about the dopamine systems, the reward systems. And if you experience this pain, like you were talking about, pushing through a barrier, getting in a cold plunge, then when you get out, you'll have this reciprocal pleasure or dopamine experience, right? So first of all, tell us about your experience with cold plunges.
So I ran cross country and track all through high school and even through college up to my senior year. So ice baths is kind of what we called them initially. Have always just been kind of a part of my life, just because it's like, oh, you got to do it for recovery, right? But beyond that, the feeling that you get afterwards, and why it's so good for pain, is that you do push through that mental barrier, and you get those neurochemicals flowing through your body, and it does such a positive thing for you. And then you get all the cytokines and everything else that just helps with the muscle recovery as well. But yeah, that's always just been kind of a mainstay of my life, because I was in that world of, being a high performance athlete and, just kind of doing those consistently. And then even when I got into PT school, I'd kind of gotten away from a lot of that stuff. So if anybody knows, going into graduate school, you kind of take a hit to your physical, or your ability to do like the physical exercise stuff. And then you start neglecting some of the other things that are good for you. And sometimes you don't even realize that you're neglecting it. So once I got into PT school and was kind of feeling that, I realized, oh shoot, I was running every day, just not like 5 months ago. And now I'm not doing that anymore. I'm wondering why I'm feeling so anxious and, out of sorts. So I had to build that stuff back into my life. I had to go do the cold showers. That's kind of how I started back into it. And then nowadays, I'll go get the ice from the store. Unfortunately, I don't have like a super nice cold plunge. I would love one. But at least, once a month. I mean, honestly, if I could do it once a week, that would be, ideal. But
Yeah, I personally shoot for 3 to 4 times a week.
Yeah, no, absolutely.
I would literally do it every day, but I want to prevent habituation. So
right.
I don't want to not get that bump in noradrenaline and dopamine there. Like I want to make sure, because you either have to continue to make it colder or go longer.
Right.
And at some point you will habituate, right? And so I want to prevent that. So I try not to go more than 3 or 4 times in a week, just because of that. But yeah. So would you suggest, like, so we talked about pushing through and doing hard things. You can do it through exercise, physically and everything. Is cold plunging or cold showers or something like that a good strategy for someone? Let's just say social anxiety. We already talked about it. Is that potentially a strategy that someone like that could use?
Oh, absolutely. 100%.
Yeah. Absolutely. Do you think it helped you, even though you didn't even know it back in the day, right? Do you think that helped you get to where you're at?
Oh, 100%. Yeah, no, 100%. All of those experiences kind of set me on a path and taught me a certain level of discipline that, later applied to other things in my life, going through PT school and knowing, okay, studying sucks, but I'm going to do it because I have to do it.
Right.
Going into this practical, this sucks. I'm anxious, but you know what? We got to do this and we've got to perform right now.
Yeah.
So all those early experiences set me up really well for everything else that came in my life. So, and
of course, growing up in Whitney, Texas.
Oh, 100%. Yeah.
Which has a pain-pleasure balance. I mean,
yeah.
Cool. Well, so something interesting, and we were able to speak with Dr. Cordell about what you guys are developing. That was a few months ago,
right?
Maybe 2-3 months ago.
Sure.
So you, Dr. Cordell Miller, and Dr. Michael Larson, y'all are developing an app, and this is for development, or can you tell us about what you're doing?
So it's a childhood developmental tracker app. So the idea behind it is developmental delays are on the rise. We know this is the CDC is reporting it, but at this point, there's not a whole lot of answers as to, okay, what do we do about it? Obviously, we know some answers because we work with it so intimately day to day, but parents don't know these things. And sometimes these delays are caught so late that, you really miss a huge window to make a big impact super early on. So the idea behind our app is that we are developing this developmental tracker that's going to track your child's progression. You're going to be able to monitor their milestones, primitive reflexes, and all these things that are super important for development to check and see if you have any delays in them. And then if a delay pops up, then there's going to be some answers for you. We're trying to build a whole clinician base around this. So a clinician base of pediatricians, OTs, functional neurologists, PTs that are really in line with our thinking that we can improve these things if we catch them early, and trying to get these parents to the appropriate provider for their child so that they can, basically just optimize their child's future.
That's great.
Yeah.
And what's it called?
It's called PATH, Childhood Development.
Nice. And when do you anticipate this will be available?
So we are still working on it at the moment, but I anticipate maybe end of summer, but more likely fall of this year.
Cool. Awesome. Yeah, so I know when we were speaking with Cordell, I think he said early to midsummer. So obviously I fully understand developing something and it getting pushed and everything.
Right,
so
absolutely.
That's just how it goes. So, well, that's really exciting. Glad you guys are doing that. That's going to definitely be a big contribution to the world. Is there anything else that you'd like to inform our audience about? Any other clinical pearls or fun stories or anything that you'd like to go into?
Oh, I just really appreciate you having me on. I thought this was a great conversation.
Absolutely, man. Well, thank you so much for coming. I thought this was a great conversation, very, very productive conversation.
Absolutely.
So obviously we talked about a few different things. If there's anything that you feel someone that you love or know could benefit from, please do share this podcast with them. That's why we're here. We're here to help people. And so please subscribe, please share, and thank you so much. And we will see you next time.
We hope today's episode has inspired you to take that next step toward your best self. Remember, the path to longevity is paved with small, daily decisions. Your journey is unique, and every step, every choice, brings you closer to your ultimate vision of a healthier, happier life. For more insights, tips, and resources, visit drbrandoncrawford.com.